Hi, I'm Dr. Bill Widener, and today we want to showcase some of the ways in which we not only treat knee pain, but also how we analyze and determine the underlying cause of your knee pain. So, first place that one of our new patients would start out when they have knee pain is here in our reception area. And it's at this point where they would have some simple intake information provided to them. They would fill that out, and then one of our case managers would go ahead and bring them into the case management room. So we would bring you over here. You would come into this room here, and in this setting we would be able to talk to you very privately and be able to listen to your concerns and your history and be able to ask the specific questions which aid us in determining your diagnosis. When we're done in this environment, you will quickly go into the examination area, and we have several examination rooms. We have this one here, and then we have this examination room here. In this room in particular, we've got a number of different diagnostic tools, one of which being our diagnostic ultrasound. This helps us with really evaluating soft tissue damage and injuries, and being able to compare that with our other diagnostic studies. Then we would bring you most likely down here into our X-ray suite department. In here we have our digital X-ray technology, and then that allows us to determine the structural integrity of the joint, and to be able to analyze that and compare that with the soft tissue. Now, as far as treatment is concerned, we have a number of different treatment rooms that focus on knee pain, one of which is our two medical rooms. In those rooms, we do advanced injections. We use a number of different injections for knee pain. It really depends on your diagnosis, but these injections are safe, they're non-invasive, and they help to regenerate and replenish the knee. Down here, we have some additional technologies that we can use. Sometimes what we realize is that with knee pain, there can be other associated conditions causing it. Sometimes it's the hips, it's the low back, it's the pelvis, it can be the ankles and feet. In this area, we have two spinal decompression tables, and they help us with correcting the pelvis and the hips and the lower back and cervical conditions. Right across the hall here, we have a room that has a number of different modalities. This table right here is called our knee on track. It's knee decompression. That table allows for us to decompress the knee, rehydrate the meniscus, be able to balance the knee, and allow that knee to have a much more comfortable movement and range of motion to it. This is one of our class 4 lasers. This also helps us to be able to address soft tissue damage. It helps us to reduce inflammation and increase circulation to the joint. Also helps with tissue repair. This is our rapid pulse wave, or our sound wave, that also helps us with ligament and tendon issues. Across the hall here, we have our passive therapy suite. In this room, we have a number of different technologies that helps us with joint balance, with muscle, tendon and ligament issues, again, inflammation, circulation, and oxygen to those tissues. So that's this, and then we go across the way here, and in this area, this is active therapy, and in active therapy, we can introduce the patient to special exercises and stretches, which helps to rehabilitate and strengthen and package the joint as we're fixing it in other areas of the office. So these, and I go over here, this is alignment. So in this room here, we help with alignment, whether it's hips and pelvis again, whether it's knees, ankles, feet, up north and south of the condition. This is an area where we can align the joint. So that's a little overview of the number of different options that we have in the office that give us such great success with treating knee pain. Hope to see you soon. Hope to be able to introduce this facility to you personally. Thank you.